All right, welcome back. We all had a great week. Today we're continuing our BCBA exam practice question series, where we're going through a set of BCBA exam practice questions and breaking them down. If you're looking for our proven study materials, please check out bcbastudy.com for our study guide, our 3 practice exams, and our combo pack, which now includes flashcards. Questions, comments, please let me know. Let us know when you pass so we can include you in our Sunday shout out. Other than that, let's work hard, study hard, get to our questions. Question 1. You're settling an argument between 2 supervisees. One supervisee believes they should use a 10-minute interval for their discontinuous measurement, and one believes they should use a 3-minute interval. What would you tell them? First things first, we're using discontinuous measurement. This entails things like whole interval and partial interval and momentary time sampling. So the interval is going to matter. It's going to make a difference. If we're using a whole interval measurement and we're using a 10-minute interval, the client needs to engage in that behavior for a very long time, 10 minutes to count as a response. However, if we're using partial interval and we use a 10-minute interval, there's a high chance the client's going to engage in the behavior during that interval. So it does matter what length interval you use. And typically, when using discontinuous measurement, you want shorter intervals. Now, why? So A, there would be no difference in measurement for each interval length. Well, that's just not true. There's a gigantic difference between a 3-minute interval and a 10-minute interval, especially when it comes to discontinuous measurement. B, the shorter the interval, the more sensitive the data. Yes, okay, because if you have a 10-second interval, it's going to be a lot more sensitive to the actual behavior occurring compared to a 10-minute interval, which gives either a lot of time for the behavior to occur or a lot of time for the behavior to not occur. The shorter the interval during discontinuous measurement is going to produce more sensitive data, typically allowing us to better measure what we're after. So C, the longer the interval, the more sensitive the data. That is not true. D, since we are using partial interval recording, we should use the 10-minute interval. So regardless of what you think about D, nowhere in the question stem does it say anything about using partial interval recording. We said discontinuous measurement, not partial interval recording. Be very careful about answer choices like that, which specifies something that doesn't actually occur or appear in the question stem. Our answer here is going to be B. The shorter the interval, the more sensitive the data. In this case, we would use the 3-minute interval over the 10. Your goal is to open your own ABA clinic after you pass your BCBA exam. What would be the most appropriate way to present your fees to the client? This is in the ethical code about fee structure and how we're presenting fees. We don't want to misrepresent what we're charging the client. We don't want to be vague about what we're charging the client, especially if we're billing hourly. So, for instance, when you first get a client, how should you present your fees? Well, A, your fees should be transparent and presented up front. Yes, your clients and potential clients should know what you charge for, how much you charge, and what is expected of them at the onset of the relationship. You shouldn't get 40 hours into billing for whatever you're billing for and then present the fees to the client. It's unethical. You need to be transparent about what they are going to pay you if they choose to take on your services. B, present your fees only after the initial assessment. Well, no, because I'm assuming you would charge fees for the initial assessment. You want to be transparent. Here's my assessment fee. After the assessment fee, here are my hourly rates. Go from there. Present your fees only after the client signs a contract. Your fees should be before they agree to any sort of relationship with you. This is for transparency. So nobody is confused about who's being charged what and who's paying what. And then D, change your fees based on the needs of the client. We should not be changing our needs based on the needs of the client unless, of course, we are being transparent up front. Ultimately, to present your fees to the client, you need to be transparent and presented at the very onset of the relationship. Which of the following is not a method for creating a task chain? I like to include this question because very few people actually know the different ways we should establish a task chain, or in other words, conduct a task analysis. Okay, but it matters because creating a good task chain, conducting a good task analysis leads to better results when we're actually using chaining, forward chaining, backward chaining, whatever method we're teaching with. The better our chain, the better our analysis, the better the results. The question wants to know what is not a method for creating a task chain in ABA. A, ask an expert. Can we ask an expert how they go about completing a behavior? What does their chain look like? Absolutely. Ask a top tier chef, ask an author, ask a top singer, right? If they're an expert in their field, you can reliably expect that they can produce for you a good task chain, a teachable task chain. B, watch another person who is the same age as your client learn the skill. So let's be careful here. What does age really represent? Well, not too much when it comes to many of the populations we're working with, okay? If we're working with autism or intellectual disabilities, there might be an age versus development gap. So we have to be very careful about this idea of age representing a whole cluster of kids, okay, or adults. If you're going to try and teach a 5-year-old using a task chain, asking another 5-year-old to learn the skill as you watch might not necessarily be the best idea. Okay, what if that 5-year-old can't complete the task? Okay, watching another person who's the same age as your client learn the skill is not a recommended method for creating a task chain. C, do the task yourself. Sure, you can do the task yourself, assuming you're competent. Record your steps and adjust as needed. Or you can D, observe a professional complete the task. Nothing wrong with that. It's similar to asking an expert. But with D, you're actually watching this professional complete whatever task you want to teach your client. The one way you're not going to do it, though, is watch another person who is the same age, which doesn't mean anything, as your client learn the skill. During supervision, you observe that your client always chooses the left picture when the RBT runs DTT using a field of 3. Which of the following strategies would be best to bring the client's behavior under control of the appropriate stimulus? Think about this question for a second. What is the question asking? It's asking about a strategy that's going to bring the client's behavior, which is choosing a picture, under the control of the appropriate stimulus. So under the control of the appropriate picture and not just the left stimulus. So that's what we're trying to identify. And we need to take our time on the question stem so we can get there. So how are we going to change our client's behavior and move it from always picking the left picture to picking the most appropriate stimuli or the target stimuli? A, implement a response cost procedure anytime the client picks the left picture. What's wrong with jumping immediately to A? It's punishment. We should try other things first, especially in a low stakes intervention such as a field of 3 and just picking the left picture. Punishment should not be our first instinct. We don't want to create an aversive. We just want to get them off the chain or the habit of always picking the left picture. B, remove the field of 3 until the client can reliably identify the difference between right and left. Now, is that really relevant to what we're doing? Is the problem the client doesn't know the difference between right and left? Not really. That's not really what it's saying, right? It's saying they're always choosing the left picture, not they don't know the difference. B is not going to help with this problem. Even if they know the difference between right and left, they still might always pick the left picture. The problem is their behavior is under stimulus control from the stimulus that's placed on the left. We need to change that. C, presents a target stimulus in different places and reinforce the client for picking that picture. Slowly fade in additional stimuli. Okay, so instead of just always putting a field of 3, picking left, we can put our target stimulus in different places on the table, around the room. And when the client picks the right stimulus, we can reinforce. Slowly, we can add in additional stimuli until the client is able to identify the correct stimulus out of a field. And now the client's behavior is under stimulus control for the correct stimulus. C is much better than a punishment or a intervention that has nothing to do with the actual target. And then D, always put the correct stimulus on the right until the client stops choosing the left. Now, obviously, creating the issue just opposite, I don't think is going to solve the problem here. Okay. The best answer here is going to be C. Present the target stimulus in different places. Reinforce the client for picking that picture. We're trying to bring the client's behavior under stimulus control of the correct stimulus. A negative consequence of punishment might be what? So on the task list, we need to know potential negative and ethical issues for reinforcement, punishment, and extinction. Punishment, usually the most obvious because it's the ones we talk about. There are ethical concerns and negative consequences associated with punishment that we're all pretty aware of. Now, can punishment lead to escape? Absolutely. Okay. If you are constantly punishing somebody, what do you become? You become an ST for punishment. Anytime the client sees you, you're signaling punishment is available. We don't want that. We don't want you to become an aversive. But if you're using punishment over and over again, the table can become aversive. All these different things in the environment can start to signal punishment. We don't want that to happen. Same thing would be avoidance. Think about a client who will do everything they can to not sit in their chair, right? The chair is now signaling to them punishment is available, for whatever means, right? We want to avoid that. Punishment can lead to escape and avoidance. You have to be very careful about creating aversive conditions through punishment. Can punishment lead to an extinction burst? Cannot. Punishment is not extinction. Extinction is not punishment. We went over this a couple videos ago. It's not the same thing. They're two different principles. Do not conflate and do not mix up punishment and extinction. So a negative consequence of punishment might be what? Well, A, escape, and B, avoidance. So D, both A and B. A client has a large vocabulary but struggles responding to questions. What type of prompt will be the least useful? Let's not overthink this question. We're dealing with a large vocabulary but struggles responding to questions. So we're looking at verbal behavior here. What type of prompt is going to be the least useful in helping the verbal behavior? A physical prompt. Can we physically prompt verbal behavior? No. The physical prompt is going to be the least useful way to correct verbal behavior. Don't overthink this question. A visual prompt, we could always write down the words as a visual for what we want them to say. Altering the stimuli, meaning we could alter what we're saying in hopes they respond differently. Or we can give them a verbal prompt, try to get them to echo us. We can't physically prompt the verbal behavior. Least useful prompt would be physical. For basic consent, not informed consent, what is acceptable? Now, there is a difference between basic consent and informed consent. For the most part, basic consent is acceptable in the majority of your situations. Informed consent would be more for research, for highly aversive or punishing consequences or interventions, or dangerous changes to your treatment plan. Hopefully you can avoid those, but if you're pushed to use a very aversive or dangerous punishment, of course we need informed consent. Now, for basic changes to treatment plans and basic interventions, basic consent is totally fine. So basic consent, what is acceptable? Obviously, a signed contract is probably overkill for basic consent. Basic consent is basically me saying, are you okay with me using this strategy to deal with your behavior? And the person says yes. Basic consent, signed contract is totally fine, as is an oral agreement. I ask and they say, yes, that's fine, or no, that's not okay. And then a written agreement. Hey, can you just sign this piece of paper real quick? Not a formal contract, but just acknowledging you accept or you consent to this treatment. Basic consent, useful in the majority of your situations. Informed consent has several more steps and several more requirements and is much more formal. Basic consent, though, signed contract, oral agreement, or written agreement, all acceptable. Jane is a principal at a private high school. She employs 2 BCBAs as consultants. Jane decides to become an RBT and wants to earn hours towards her BCBA. Can she use one of her BCBAs at her school? So put yourself in the BCBA shoes here. Your BCBA working at a school and your boss, principal, decides she wants to become a BCBA. Now, she's also your employer. Can you give her supervision hours? No. If she's employing you, you cannot supervise your own employer. Obvious conflict of interest there. So A, yes, as long as the BCBA is a qualified supervisor. Of course, you need to be qualified to deliver supervision, but as long as she's employing you, you cannot supervise her. B, yes, as long as the BCBAs have taken the supervision modules. Again, you should certainly do that if you plan to supervise, but this is your employer. You cannot give her hours. C, no RBTs cannot employ their supervisors. Right. So Jane is now an RBT. She wants to earn supervision from you. Not possible. Okay. She's your employer. You can't deliver supervision. Finally, Tallulah is running a 4-person relay race. The sound of a gun signals the start of a race, and it takes Tallulah half a second to start running. It takes Tallulah 20 seconds to reach her teammate. Tallulah hands the baton to the teammate who starts running towards the next teammate. If you're measuring Tallulah's start time, what measurement would you use? Okay. So, what do we know about Tallulah's start time? We know the sound of a gun signals the start of the race, and it takes Tallulah half a second to start running. What is the question giving us? Is it giving us latency, into response time, duration, or rate? We can eliminate rate because we're not taking frequency here. There's no frequency data. We can eliminate duration. We're not measuring the duration of Tallulah's behavior. We're measuring how long it took Tallulah to start her behavior. IRT will be time in between, let's say, passing the baton. Again, not what we're looking for. We're actually looking at the difference between the time in between the SD, which is the gun signaling the start of the race, and the start of Tallulah running the race, which would be half a second. So Tallulah's latency would be half a second. If you were measuring Tallulah's start time, in this case, half a second, you would use latency. All right. Hope you enjoyed. Please like and subscribe. Check out bcbastudy.com for all of our study materials. Questions, comments, let me know. Work hard, study hard. See you soon.